Hi, everybody. It's Amy with Blue Soulspace, and I'm here again today with Kallie Harrison, Dr. Kallie Harrison, and she is a practitioner here at Blue Soulspace in Park City. And Kallie and I both are both acupuncturists, herbalists, and have been doing Chinese medicine for most of our career. We're also working in the field of psychedelic medicine as a psychedelic integration coach and guide. And it's really a fascinating field for both of us. That's why I think we've dove into this area. And I know a lot of people have a lot of questions about psychedelic medicine. It's like, what is this new thing that people are talking about? And is it safe? And is it for me? And, why should I do this or why should I not do this? So I thought Kallie and I could just talk a little bit about it because I feel like people have a lot of questions and we're hopefully here to help guide you along this process of learning about it. So Kallie, tell me, I know you've got quite a bit of training now in psychedelic integration, and can you tell me what led you into this field and what you like most about it?
Yeah, I mean, it's always a personal story, right? How things begin, at least for me. So I've had my own personal experience with using psychedelics and plant medicine, and it started to show up in my practice about 5 years ago. A lot of patients started asking me about psychedelic medicine, what I knew about it, is it safe? Probably the similar questions that you've received. And I was really drawn to the California Institute of Integral Studies. They have a year-long training there. And so I had been looking at it. And then once I started getting more and more patients asking about it, I decided to apply for that year-long program and did that on the East Coast. So it was half in person and half in line. So flying back to Boston and did that year-long training, mostly with medical doctors, psychologists, psychiatrists, a few nurses. And alongside that training, I also got MAP certified, and that's the organization that's helping get MDMA FDA approved.
Yeah, that's exciting. That's getting close, isn't it?
Yeah, hopefully really close.
Yeah, and just to look for a little background, MAPS has been doing a lot of work with vets.
Mhm.
So they've been using MDMA to help heal a lot of PTSD and trauma that a lot of war veterans have had no other solution to address this. So MDMA has finally been recognized as something that's actually helping millions of vets and other people with severe trauma. So it's exciting that we're seeing like real application with people who are in severe need of help. And then I think now we're also looking at some other psychedelic medicines that are helpful for depression, for anxiety, for general mental health issues that I think like a large proportion of our population suffers from, whether they suffer publicly or just privately, really.
Correct. Yeah, I mean, I'm seeing it everywhere. Um, and people are just interested. And so I feel like for me, I really wanted to have the education on how to educate patients properly and clients and just, community. Is it safe? And what I have found really important is helping people prepare for those experiences and helping them integrate. Because I have found if you're not prepared and you don't know how to integrate, then it's not going to do you any good. It's just going to be an experience. So I have integration and preparation are, yeah, they're so big to me.
They're almost more important than the
Yeah.
actual experience of the journey itself.
Mhm.
Because like you, I mean, I've had plenty of experiences myself where the integration or the aftercare part of it was not incorporated. And, I think when people talk about having bad trips or bad experiences, a lot of those, well, they have a lot to do with the setting or maybe the people they were around, but a lot of it can also be word, the aftercare that they do or don't receive. Because if intense emotional states come up for you during a psychedelic experience, they're there for a reason. They're messages from your own internal psyche, and they need to be addressed in some way. You can't run from them. They're a part of you. Uh,
Mhm.
so having the proper guidance and care afterwards is really important, and having somebody who has some training and also personal experience. I think that is really what's happening now in this field is a lot of people are jumping into doing psychedelic therapy without having actually even done psychedelics, which is sort of crazy to me that, we have people running clinics
Yeah.
for psychedelic therapy who've never even tried the medicine. So I think it's very unique. And I think if you haven't had your own personal experience with it, it's a little bit harder to counsel others to work through their own experiences if you haven't done the work yourself. So
Right.
as you probably are doing, you have to continue doing your own work. If you're going to work with others in this unique field, you have to continually do your own personal work.
Yeah, 100% all the time. Never stops.
Never stops. Signing up for a lifetime of it.
Yeah.
But what would you say are the benefits from it? What would you say personally that you've seen in yourself or with others that, yeah, it's the work is difficult for sure. And that's why a lot of people aren't ready for it. But what do you see as what is the outcome for people who do the work?
The first word that comes to my mind is freedom. Um, I feel like just in the society that we've been raised and grew up in, we whether we are put in an invisible cage by others or we put ourselves in an invisible cage by patterns and conditioning. And I see a lot of people be able to break free from that cage and repattern and unlearn and decondition so they can create healthy patterns and healthy conditions in their body. And I feel like that's one of the biggest things I've seen. It's like, it's almost this coming home to yourself in the most beautiful way.
Mhm. Yeah, I think that you described that beautifully because I think people are always seeking spiritual experiences, right? I mean, it's what religion is surrounded with, and people are trying to get closer to something more, close to God. But I think really that when we realize like that closeness we're seeking is within us, once you do work that actually gets you connected to yourself and who you really are, I think people experience that sense of, oh, okay, I don't need to be seeking outside. I have so much of this knowledge and this wisdom inside of me.
Mhm.
And I think that does give you a sense of freedom because you don't have to be on a path of looking externally for things and people and experiences to feel whole.
Right. Everything we need, we already have inside.
Yeah. Yeah. And I personally believe I think acupuncture has been helpful for so many people to prepare themselves
Mm.
for psychedelic journeys and experiences because acupuncture is such an energetic reset or reboot, I call it, for people to get more aware of themselves and their bodies. And then it's like priming the body and the mind and the spirit and the psyche for this greater awareness that psychedelics can sometimes offer if you are more open, you know,
Yeah, I
and
found it really powerful to do, do preparatory sessions with using acupuncture and Chinese medicine, and then for integration as well.
yeah. Yep. So that's where I feel like, yeah, we both have that unique ability to offer the energetic acupuncture prep and integration, and then also the training for helping people to sit with their experiences and yeah, and also we're also both, I think, really open to trying to educate people who just need to learn a little bit more about this new field. I think it is exciting. A lot of it has to be, you've got to be really ready for it. So you kind of do have to do your own. Nobody's going to recommend that you do it. You have to be, you have to like learn on your own and educate yourself on your own. And then you'll know when you're ready. So feel free to reach out to us if you need to learn a little bit more.
I'm here to help and answer any questions.
Yeah. Well, thanks for chatting with me about this, Kelly. We'll have more discussions, I'm sure.
Awesome. Thanks, Amy.